So these two masks are both really useful and they can both help to prevent the transmission of viruses, including the COVID virus. The cloth masks are more accessible. So we see that anybody can have access to them. You can even make them at home. And they're really meant to be used to prevent the transmission of the virus from you to other people. So when you can't control who's coming into your 2-meter bubble, this cloth mask is something that is used to prevent transmission from you to other people. And if the other people are wearing it as well, it's useful for you. This kind of a mask is used when we want to really make sure that somebody who has the virus is not going to infect us, okay? So this is a type of mask that we use when we're more at risk, and in particular when we think that we're going to be in a hot situation. And a hot situation is something that physicians and nurse and health practitioners experience all the time. And this is the kind of mask you may want to use if you're someone at risk coming into the hospital. So this is more useful than a cloth mask at protecting you from others who have COVID. The key thing to taking a mask off is to start by recognizing that during the day when you're wearing a mask, you really should be keeping it on your face, covering the nose. Obviously a mask doesn't do much good if it's down here on your chin, and it's not very effective if it's down here just covering your mouth either. If you're going to be taking off a mask, you want to be cognizant that the virus could be on the exterior surface of the mask. And so when you're taking it off, you're using both fingers at a time, pulling it away from yourself, and then holding it up and putting it somewhere. If you're going to be reusing it, hanging it on something for 3 days. Then you can reuse your mask. Yeah, so, having to have something on your face all day long is not something that anybody loves. There's nobody who loves wearing masks, although there may be a few. The masks and the irritation that they cause on your skin is really mostly a physical phenomenon. So when we're breathing into the mask, the humidity that we generate with our breath is essentially irritating our skin by making it go through cycles of evaporation. And the benefit to using masks is such that you want to be able to continue using them even if they are irritating your skin. One of the principles to keeping your skin healthy when you're wearing masks is to be careful about and to be aware of when you should be using the mask and when you do not need to be using the mask. So one of the things that we can talk about are circumstances when we need to use the mask and circumstances that we don't need to use the mask. So one of the circumstances that you want to use masks in is the really important part is any time that you're within 2 meters of someone else, okay? So anybody in your bubble, you've got to put on your mask, okay? And if you can't control for people coming in and out of your bubble, say for example, you're at a busy grocery store, etc., then you're going to be wearing your mask the whole time. If you're in your car driving and there's no one else in the car with you, you don't need a mask. If you're going to be walking outdoors, walking your dog, and you can easily switch positions or cross the street anytime someone is coming near you, you don't need a mask. So these are some aspects that we can incorporate into our mask wearing that can minimize the amount of time that we are wearing the mask, really focusing their use to the periods of time when we may be at risk. When we are wearing a mask, a lot of the humidity from our breath irritates our skin because it causes our skin to become moist, and it can encourage all sorts of little ecological imbalances. One of the ways that you can approach that is by essentially using more barrier cream. Okay, so your skin is like any other barrier, needs to be reinforced from time to time, and oftentimes just enough moisturizing cream applied on a regular basis can help to prevent those evaporative losses or that kind of mechanical irritation that comes from wearing a mask. If you do develop any kind of worsening of a pre-existing skin condition, it'd be important to then talk to your doctor or dermatologist.